you're dealing with a lower back pain flare-up, it can be frustrating, especially if you're someone who lives for the gym, training hard, and chasing PRs. I'm Dr. Jeff Lewis, owner of Lewis Physical Therapy and Sports Rehab, where I help countless CrossFit athletes over 30 get back to RX workouts without scaling or modifying, even after injury. In today's video, I'm going to break down 3 things you need to do when your lower back flares up. And trust me, doing these right can save you weeks of setbacks and frustration. The first thing you need to do is keep moving. Now, I don't mean go and maxing out on deadlifts or back squats, but the worst thing you can do is stop all activity entirely. Total rest usually makes things worse. Your joints stiffen up, your pain sensitivity goes up, and your recovery slows down. Instead, I recommend finding non-painful movements initially that feel good and don't flare your pain up. That could mean something as simple as walking, belly breathing or diaphragmatic breathing, training upper body lifts that don't aggravate symptoms and require a lot of excessive pressure throughout the abdominal region, and then core work in pain-free positions. As cliche as it sounds, motion is lotion. I want you to think of these movements as a way to pump blood, calm your nervous system down, and let your brain know that your body isn't in danger. Next up, do not rush into getting an MRI or X-ray the second that your back hurts. Here's what most people don't realize. MRI findings do not always match pain. In fact, many studies show that a majority of people who don't have back pain will still have things like disc herniations or spinal stenosis on an MRI. So if you're in pain and you get an MRI, you might see that something or might be told that something is wrong, but that doesn't mean it's the cause of your symptoms. Unfortunately, this can lead to several things: fear-based decisions, over-reliance on passive treatments like injections or medications, and sometimes even unnecessary surgeries, which, by the way, typically don't have better long-term outcomes in many cases than non-surgical rehab in a lot of different lower back injuries and pathologies. Unless you are dealing with red flag symptoms like loss of bowel bladder control, progressive leg weakness, give your body time to settle before jumping right into imaging. Last up, don't be afraid to get back to movements like squats, deadlifts, or other barbell or intense movements that would otherwise be painful if you did them right out of the gate of a lower back pain flare. The key here is proper timing, progression, and guidance from a trained professional. You don't need to avoid these lifts forever. In fact, if you never train them again, your back's probably going to become less resilient and strong over time. What I recommend you start by doing is identifying the variation that hurts. So instead of deadlifts, maybe you're doing RDLs. Instead of back squats, maybe you're doing goblet squats. Progressing over weeks as symptoms calm down, and then dialing in your tempo, bracing, and control. All of this is exactly what I help my clients with, building back confidence in their bodies while training around pain and slowly reloading tissue tolerance so that they don't just get out of pain, they get stronger than before. So to recap, keep moving. Don't rush to imaging, and gradually reintroduce the lifts that you love. You don't have to train in fear, and you definitely don't need surgery to fix your back. If you want to learn our step-by-step system that we use to help CrossFitters get back to RX workouts after an injury, text RX to the number below, and we'll send you your free copy of the RX Blueprint.